This is Dr. Bharati Morey, and today I'm going to speak on gestational diabetes mellitus. 14 November 2023 has been announced as the World Diabetes Day, and WHO has announced as empowering global health as the theme for the same. As obstetrician and gynecologist, we are the first point of contact for our patients, whether they are antenatal or not, provided all of us share that responsibility of doing the tests to detect the diabetes mellitus. The global incidence is as high as 12%, and India, being a diabetic nation, is not behind, with 1 million cases detected antenatally every year. So, my dear friends, it is our job to take care of the So, my dear friends, as obstetricians and gynecologists, we share a major responsibility of reducing the incidence of diabetes mellitus in India, especially the gestational diabetes mellitus. What are the tests by which we diagnose this? It is simple blood test which is done. Internationally, the 75-gram loading glucose is given, and then 2 hours the patient is asked to fast. After 2 hours we take the blood and we can diagnose whether she's normal, she's pre-diabetic, or she's diabetic. Then once they are diagnosed, you should know what is their presentation and who all are at high risk. Believe me, my dear friends, those who are obese, those who are physically inactive, those who had diabetes mellitus in previous pregnancy, PCOD, which is on the high run all over the world, they are more prone for developing gestational diabetes mellitus, and if there's a family history of a near and dear one having diabetes mellitus. What is the effect seen on both the mother and the baby? Now, this depends on what trimester your patient comes to you. If she comes in the first trimester, then GDM has the high risk of having congenital abnormality in the baby, and you will see that the cardiac abnormalities are very high. Then, if she comes in so the major problem is whether she can continue with the pregnancy or not, and you are the one who are going to make the decision. Then the second trimester, if she comes, second trimester, you have to see whether your baby is growing well, whether your blood pressure is not increased. All these things go hands in glove. Third trimester, if she comes, most important thing is because of the diabetes mellitus, your baby is going to be heavyweight, more than 9 pounds. Therefore, operative intervention is more increased incidence of the mother landing with a cesarean section, and of course the complications that come with the operative delivery and the operative intervention. And of course, one should not believe if her diabetes is not controlled, then there is sudden intrauterine fetal death, which is not a good thing to happen, and the babies are too large, and therefore, despite of the IUFD, maybe she has to undergo a cesarean section. So it is not a win-win situation for the patient and for the doctor also. And hence, if you control the diabetes mellitus, you pick up in time, control the diabetes mellitus, whether it is sure on diet or with medical management with tablets or on insulin. If the sugars are maintained within normal limits, she stands a chance of having a normal delivery or a cesarean section as any other patient not having diabetes mellitus. That's why, my dear friends, as obstetrician and gynecologists, if we pick up the diabetes mellitus, especially the gestational diabetes mellitus in time, we can definitely reduce the maternal mortality and the parental mortality incidence of our India. Thank you.
Ma'am, can you tell us about how gestational diabetes is occurred in patients?
Yeah, it occurs because of when the patient is pregnant, it is the placenta which secretes a particular hormone, and that doesn't allow the insulin to act on the body effectively, and that is why it is the GDM that occurs in the patients.